let's talk about trauma and the obstructions that can be caused because of trauma. So anytime you have a fracture in your nose, a lot of times the swelling and sometimes the break can sometimes affect your ability to breathe. And so that's very important that we look at that and try to fix it if at all possible. So if the nose gets broken, somebody punches you in the face, or you fall down a flight of stairs, or you're like me and you just don't see where you're going, you run into a door jam. I've never done that. What am I talking about? Anyway, so anytime you do anything that breaks your nose, a lot of times what will end up happening is you'll have swelling of your soft tissues in the area. You might notice some internal and external bleeding because of that fracture. You also might end up having some nasal deformity. Yeah, you probably will. Okay, so a lot of times what you're going to see, the nose gets broken, it kind of shifts, right? Because of that shift, you're going to have some obstruction with your ability to breathe and to have discharge. If it's really severe and you start noticing clear fluid leaking out of your nose that does not look like snot, okay, this is very important. Clear fluid leaking out of your nose after a fracture doesn't look like snot, we want to test it to make sure that it's not cerebrospinal fluid. Okay, the reason why you might have that is because this is all kind of in close proximity, isn't it? If you have CSF leaking out of your nose, that is very serious, because once we get to neuro, you're going to see that it has to be a perfect, happy little balance in the brain in order for everything to function normally. If you're leaking CSF, you might end up seeing some central nervous system, peripheral nervous system, all kind of nervous system impairments. Okay, very important. The only way that you can test that is by using a dextrose stick. Okay, a dextrose stick tests for the presence of glucose within that fluid. Normal mucus will not have glucose, but cerebrospinal fluid will. It's very important that you do this, okay, if you start noticing that clear fluid. A diagnosis of a broken nose or a fracture of the nose might be delayed, because typically there's going to be quite a bit of swelling and bleeding initially. Once that subsides, that's when we can actually tell if the nose is broken. It's a really frustrating time for the patient, because they're like, well, is it broken? Is it broken? And we're like, I don't know, because it's too swollen. I can't see the bone. To treat it, we want to put a cold compress just to reduce the swelling. And if we have determined that it is fractured, they're going to have surgery to reset it. Laryngeal trauma and obstruction. Now this is very frightening, okay, because laryngeal trauma is very close to our airway. If we have trauma from, for example, a motor vehicle accident, a lot of times this happens with the driver. They're driving along, they hit a car, gunk, their neck goes into the steering wheel. That can sever the patient's neck. At best, it's causing laryngeal trauma in there. It's extremely serious, very life-threatening. It's really terrifying, actually. Anyway, so if you see that happen, or you know that it's happened, these people need to get an artificial airway pronto. Okay. Now, you also can have laryngeal obstruction from food or swelling from an allergic reaction or any other kind of item that is blocking your airway. You just aspirated a Lego. I don't know why you'd be chewing on a Lego, but if you were and you aspirated it, this could cause an obstruction. The signs and symptoms. Your neck is going to swell. You're going to notice quite a bit of bruising and tenderness, and probably some stridor. That's really raspy, hard, rough and coarse breath sounds as they breathe, like okay. Dysphagia, very difficult to swallow whenever you have this obstruction or swelling or bruising or whatever in the throat. Hoarseness of the throat, absolutely. Sometimes they lose their ability to speak altogether. Cyanosis, yeah, most definitely, because that's impairing your airway, isn't it? And if you're not having a clear airway, you're not perfusing well. If you're not perfusing well, guess what? Everything is good. You also might notice some possible hemoptysis, which means bloody vomit, okay? Or bloody sputum, sorry, not vomit. Lost my train of thought there for a second. Bloody sputum. Blood in your sputum is not ever normal. If you ever notice blood in a sputum, you need to report that to a physician, okay? To diagnose it, we need to get a laryngoscope, and that's going to visualize the structure and see what it is that's obstructing it. To treat it, we want to maintain their airway. Oh boy, do we want to maintain their airway, because we have to breathe in order to live. Our entire body relies on and depends on oxygen. If we don't have oxygen, we die. If it's a foreign body, say you were chewing on that Lego and you accidentally aspirated it, or it even could be just a piece of chicken, anything. You aspirate something and it's caught in your throat, the way to get it out is the Heimlich maneuver, and you learned that in basic life support training or CPR class. Epinephrine and corticosteroids typically help to reduce swelling if it's caused by some kind of allergic reaction or just swelling for some other reason. Possibly they might have to intubate. Whenever you hear that word intubate, that means they put a breathing tube down into your lungs, and that is an artificial airway and helps you breathe without your body doing it really on its own. If it's very severe and they're not even able to get the breathing tube in, intubate them. If they're not able to intubate, then they might need to cut into their trachea directly and do a tracheostomy, and that is the very last thing that you want to do, okay? But it is a viable option. You're not going to be doing that. The doctor will, but just so you know what to prepare for and when they do these things. It's for emergent situations where there's no way they're going to get oxygen any other way. Sleep apnea. Usually this is characterized by frequent or brief episodes of respiratory standstill during sleep. I'm sure you know of at least one person who has sleep apnea when they are sleeping. Okay, basically they're lying there, they're sleeping, all of a sudden they stop breathing for a couple of seconds. Okay, happens every now and then. Typically it's pretty frequent if you are suffering from that. There's different kinds though, and they're characterized just based on whatever respiratory effort is needed. So central sleep apnea is whenever the air movement is totally absent, meaning like they just stop breathing, and it's usually secondary to the absence of the ventilatory efforts like sent from the brain. Basically the brain just fails to tell you, hey, time to breathe now. Usually we don't even think about it, you know. A lot of times our brains are just functioning normally, especially when we're awake. We just breathe. We don't even tell ourselves to breathe. It just happens. Well, when you're sleeping, sometimes your central nervous system fails and it doesn't send that signal to say, hey, the body needs air, go ahead and breathe now. It's not good, especially if it lasts for a very long time. The most common type, let's pretend I didn't say that, is obstructive sleep apnea. And this is caused by some kind of obstruction, okay? Typically this occurs when people are overweight and they have a lot of extra weight settling on their chest. It decreases the effectiveness of their respiratory efforts, and it also sometimes can obstruct and impair the ability of their airways to intake air. So what we want to teach our patients is lose weight or just figure out whatever it is that's obstructing. There is another type that's called mixed, and this is a combination, and this is to me the most dangerous because this is where the brain is not telling the body when to breathe, and you have some kind of obstruction, and so it's kind of like a double threat. You know, you can't really control that at all without intervention. So let's look at this. Over 12 million Americans actually have obstructive sleep apnea. It's very scary because we are losing oxygenation while we sleep. 1 out of every 25 middle-aged men has obstructive sleep apnea, and 1 out of every 50 middle-aged women has obstructive sleep apnea. It's characterized, like we said, of repeated apneic episodes, and eventually it's going to have serious effects on your cardiopulmonary system, because if you're not getting oxygen in your body, then the blood's not holding on to oxygen, and then that oxygenated blood, it's not as rich, right? And so when it's going throughout our bodies trying to feed all of our organs and our tissues with all that good oxygen, it just doesn't have enough to go around. So you might start seeing some other issues within organs and tissues, and maybe some cyanosis and everything as well. Apneic clients with hypertension have increased risk for strokes, heart attacks, dysrhythmias, and even heart failure. Very, very important that we diagnose this and fix it as quickly as we can, because we don't want there to be any serious effects. During sleep, with obstructive sleep apnea, you're going to notice loud snoring, okay? Because whenever they have something obstructing their larynx and their trachea and everything, maybe that extra weight or whatever, you're going to hear that when they're trying to breathe. You also might notice breathing cessation for 10 seconds or more. That's kind of a long time. We shouldn't be doing that for a long period of time repeatedly. The episodes may occur many times per hour, ranging from a few to 30 times every hour, meaning they're not going to be breathing for a large portion of time. up to several hundred episodes a night even. A lot of times they'll awaken suddenly, usually with a loud snort. They'll be sleeping, all of a sudden they stop breathing, and then they like that, because basically their O2 levels in their blood has dropped so drastically that their body is basically waking them up on its own, saying, I need oxygen, I need oxygen. And so as they wake up, then they're able to kick themselves back into breathing regularly. So if these are some of those tools that we use to diagnose if they have sleep apnea or not. If they are really sleepy during the day, daytime fatigue, that's letting you know they're not sleeping effectively at night, and they're probably not also getting the oxygenation that they need at night. They'll have a headache in the morning because of the decrease in oxygenation, and a sore throat because of just all of that obstruction and pressure that's been put on their larynx at night. They also will have an inability to concentrate because of the lack of oxygenation that's been getting to their brain. Maybe some enuresis, which is bedwetting, because all of our organs need oxygen to function properly. If you don't have that oxygen, oh my goodness, everything is stopping. Maybe some erectile dysfunction as well. There's a lot of different things that can go wrong if our bodies aren't getting the oxygen that they need, especially while we're sleeping, because that's when our bodies repair and heal and rest and rejuvenate and get everything that they need, right? All right, diagnostic tests that we do, basically we're just looking at the symptoms first and foremost. If the symptoms are bad enough and they meet several criteria, then we can do a polysomnography, which is a sleep test. And when we do the sleep study, they hook them up to several things, they watch them, they see what their oxygenation levels as they sleep, and they watch the apneic episodes and see, what's causing it, and things like that. To treat it, it just depends on the severity. Lifestyle changes, like I said, lose weight, okay? That's the best thing you can do. Stop smoking. Smoking enlarges your tonsils. It causes inflammation. It causes irritation. And it also causes changes in your ability to process oxygen and intake oxygen. Eliminate alcohol and medications that actually depress your respirations. Alcohol makes you it slows down all of your nervous system, and it makes you not able to process even the most basic commands that come from your brain. And so it's not good to ever over-imbibe or take too many medications that suppress your respirations. You can have a specialty pillow that helps to promote side sleeping so that it opens up your airway and doesn't allow for anything to obstruct as you lay on your back. Allergy medications and saline sprays can also help to reduce congestion that can be obstructing as well. To treat it, we're going to put them on a CPAP or a BiPAP. Both of these help the client receive airway pressure. We will talk about this more, I guess, in depth maybe in class. It's not really that important, but basically only difference is continuous pressure versus 2 levels of pressure. One delivers the pressure regardless, the air pressure. The other one, it depends on your respiratory effort, and it kind of kicks in whenever you don't have enough air coming in. But both of them just really help you to have as much air as you need as you sleep, and keep you from having those apneic episodes. Alright, I'm going to stop and we'll come back and talk about laryngeal cancer in a little